是4月15号，星期四。那么本来是3点钟，好像上周的星期四也是2点钟开始。今天呢是有一个更新的这个模型，不是模型吧，也就是那些数据啊，汇总啊。那么事先呢，他们已经发给我们看了看。最新的一些数据，那么大家可能会关心，到时候呢，Bonnie Henry 会根据 PowerPoint 的页，会一个一个给大家介绍一下。那么今天呢，它是多发了一个版本，还有一个版本呢，就是工作场所的零星案例的分析。那主要是2个地方，一个呢是低陆平原的沿岸卫生局，第二个呢就是飞沙卫生局，这2个重灾区。那么内陆卫生局的工作场所的零星的案例，它没有录入这次的汇报里边去，所以这次呢，他们是给了两个文件。那么第一个呢是大家他会看到的，就是那种之前一直给大家更新的一些数据的模型啊，分析啊，年龄啊等等。那第二个就是工作场所的那个工作场所零星案例比如说我略微看了看，我也没仔细看，没时间那么比如说那个食品加工厂有多少啊，这个农场有多少啊，那个零售业有多少？这个其实大家还是关心的，因为他这么写，可能也就是说工作场所传染的案例不小。那么工作场所呢，现在主要还是essential workers， 主要是基础工作，比如说食品加工厂。食品加工厂呢有2类，一类呢是水果加工厂，第二类呢是禽肉加工厂。之前在这个第2波，也就是去年的夏天以后爆发的几个温哥华、本勒比以及树里的有一些这个禽类加工厂的联合禽类加工厂，是连锁工厂等等都是处在这个禽肉加工厂。后来呢又出现了这个蔬果加工厂等等，因为这些都是基础工作。我们也是经常，我相信大家都是通过社交媒体或者是主流的报道或者是中文的这种网站微信都会看到一些零星的案例某某这个什么那个麦当劳某某 Tim Hortons 怎么当然我觉得呢，人类呢从1年多前初次接触这个病毒，一直发展到现在不单单是普通的老百姓，不单单是这个专家都对这个病毒呢有了一些初步的从恐惧到慢慢的掌握熟悉尤其是我们普通的老百姓一开始就觉得空气里边都是毒这个是很紧张。当然小心不会错，但过分小心对自己是带来不方便也自我限制了很多活动这个，所以这个也是不可取但是粗枝大叶这种什么都无所谓，这个绝对是给自己带来风险和危险，所以这个更加不可取。所以这个也是希望能够引起重视的。那么对于他们公卫系统的工作人员来讲，特别是首席医官 Bonnie Henry， 因为现在1年多来 BC 省每一次就是这个卫生紧急状态，因为根据法律呢，卫生紧急状态好像是只有我一下子想不起来了多少时间每一次过了这个时间呢，一定要延长。这么省政府省长可以签发这个决定，说我本省延长卫生紧急状态，延长卫生紧急状态。那么什么叫卫生紧急状态？我们可能听得多，但是知道的很少。也就是在这个 BC 省卫生紧急状态下，首席卫生官所签发的一切命令相当于政府行政命令，所以他可以签发说所有堂食都要禁止。这个不是政府说的，是卫生官发的命令。那么省政府呢，就是维护和执行这些命令。那么同时呢，执法机构law enforcement 执法机构呢就去配合。所以这个呢才是卫生紧急状态法 这个真正的含义啊，不能说我们大家都口说无凭说这个卫生紧急状态啊，好像一开始还比较紧张，什么叫卫生紧急状态啊？后来也就这么回事。其实这个呢是对政府运作以及执法机构是一个 code， 对他们来讲是一个代号。我相信除了这个卫生紧急状态以外，还有什么灾难紧急状态啊，等等等等我们 BC 省从2015年以后。对我们来讲啊，华人移民来讲，2015年以后，这个紧急状态发布还是频繁一些的。最明显的就是16年、18年还是2年、3年，就是大温地区这个森林火灾引起的空气质量污染啊，这个也是 BC 省紧急状态，但不一定是卫生紧急状态，可能是这个灾难性的什么紧急状态。那么这个紧急状态下啊，省政府应该做哪些？各个部门应该怎么执行？然后执法机构怎么做啊？这个就是音乐停了。那么他们已经出现了首先出现的是卫生厅厅长 Andrew Dix， 后面跟的就是 Bonnie Henry。今天也是做个开场白吧。他们说，一定说到要感谢原住民我们这块土地这是 BC 省的法律。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for Thursday, April the 15th. We're honored to be here on the territory of the Lekwungen-speaking people of the Sanghees and the Esquimalt First Nations. Tomorrow, Friday, there will be a written briefing on relevant information with respect to the COVID-19 pandemic at about 3 o'clock, and we'll be back here on Monday with a regular COVID-19 briefing in the afternoon. And with that, it's my honor to introduce Dr. Bonnie Henry.
那么现在就是 Bonnie Henry 来了。
Thank you and good afternoon. So for today, we'll start off with the case update, and then we have our COVID data update today. So today we have 1,205 new cases diagnosed in British Columbia, bringing the total number of people diagnosed with COVID-19 to 116,075. The new cases, 301 are in the Vancouver Coastal Health Region, 730 people live in the Fraser Health Region, 38 people are in Vancouver Island, 69 people are in the Interior Health Region, 66 people are in the Northern Health Region, and one is a new case in a person who normally lives outside of Canada. We currently have 10,052 active cases across the province, of whom 409 are now in hospital, 125 in critical care or ICU. There are 16,217 people under active public health monitoring and 104,331 who have recovered and are no longer infectious. We've had 3 new deaths from COVID-19 in the past day, bringing the total number of people in British Columbia who've died from COVID-19 to 1,524. As always, our condolences go to families and caregivers and to the communities who have lost loved ones. We have no new outbreaks to report and 7 active outbreaks now in long-term care, assisted living or independent living, and 5 in acute care centres. To quickly go through the vaccines, we've delivered 1,235,863 doses of all 3 of our COVID-19 vaccines in British Columbia. And today, anyone over age 55 is eligible to receive the AstraZeneca vaccine from pharmacies around the province, and people 64 and older, and Indigenous peoples and people who have received their clinically extremely vulnerable letter can book appointments through our Get Vaccinated program. Let's move on to our data update for this month. To start with, this is the geographic distribution of our cases of COVID-19 by health service delivery area. The graph on the left in the blue is the cumulative cases by geography since the pandemic started, and on the right is the last 7 days. And as we can see, and what we've seen in the numbers that have been reported over the last few weeks, we've
特别紧张的心态，休息好，多喝水一定没错不要空腹去。这个呢是根据这个居民的所在的地方，然后呢这个是各个卫生局从1月份到3月份，从去年1月份到今年3月份的这个分布状态越深的表示就是人数越多。这个可以看得出那个从这个小图看得出来左下看得出来就是大温地区的分布越深的地方人口越多，就是阳性案例越多集中在树里 Delta 以及兰里阿布兹福，不是兰里阿布兹福。
If we look at the last
这个是
the last 7 days by area of residence, we've seen a transition in the north from the northwest to the northeast, and partly that is because of the vaccination program that we've had in communities across the north that have brought down rates of transmission in some of those communities, and Prince Rupert is an example there. We have ongoing challenges in high rates of transmission in many of the HSDAs in our local health areas in the Fraser region, particularly in and around Surrey and the Tri-Cities area. These next two plots are what we call dot plots, and I want to present these today to give you an idea of some of the data that we look at by geography on an ongoing basis and have been using to help us direct where we know transmission is happening in communities, but also our immunization and outbreak response programs. So this one shows the average daily rate of new cases per 100,000 population. So this is a rate of where we're seeing the most transmission in communities around the province for the week of April 7th to 13th. What stands out here, of course, is the local health area called Howe Sound, and that includes Whistler. And this was one of the pieces of information that we used to address the outbreaks that were happening in Whistler since January, and we've seen this rate fluctuate because of the outbreak measures that were taken there, and it is one of the things that we use that help drive the decision to provide immunization to workers in the community in Whistler. We've seen ongoing high rates of transmission in Surrey. That's something that's been steadily high transmission area through most of the pandemic. And of course, you can see here that Peace River South, which includes places like Dawson, are showing up right now, as well as Windermere and Revelstoke in parts of the interior. The next dot plot is total case counts. So the two of these taken together give us an understanding of where rates of transmission are highest, but also the burden of COVID-19 in different communities. So these are two of the pieces of information that we have been using over the last months and weeks to try and direct particular our outbreak response programs. That's includes things like rapid testing, having increased testing available in certain communities, and also now immunization. And this is why we are focusing, for example, our worker program, which we have started up. Initially, we were using the AstraZeneca, the Covishield vaccine, to target these communities and people who were in higher risk workplaces that we've identified. We're now using this to ensure that we are targeting the key workplaces where we're seeing transmission and where we need to protect people like our first responders. So we've seen transmission in Surrey, for example, and that's why we're focused on fire and police services starting in Surrey. Starting in some of the other higher risk communities as well. And that will, over the next few weeks, ensure that we're able to, by area of risk, provide vaccination to all first responders. We've also been using this type of data about where risk is greatest to target our school and child care worker program as well. And as you know, we started in Surrey with the Surrey School District for these very reasons, that we know that the risks index of
那么据
transmission
我
in
知
the
道呢，我
communities are
我自
highest
己最
in
近
the
碰
Surrey
到
School
这个
District,
我
and
孩
we'll
子的
present
中学
some
的
more
老师
information on that.
他们
So I
几个
just
星期
want
前
this
都打
information
了
to be out
这
there
个
so
这个也
people
是好消
understand
息
how
给
we're
老师
making
先武
some
装
of
起
those
来。
decisions, sometimes very rapidly, as we see developing cases happen in different communities around the province.
所以他说这个
Going
这
back to
张
some
图
of
呢
our
也是让他
epidemiologic
们公
data,
卫系统
this
去
is the
制
daily
定
cases,
相对的
hospitalizations,
政
and
策去
deaths
应对。
by
那么这个呢
dates
是
of
每天
report,
新
and what we
增
can
的，
see in the
包
green
括
at
这
the
个
top
死亡以
is that
及
we had a dramatic
住院率
increase
是
in
从
the third week of March,
2020
and
年的1
this
月份
was
到
during the
2021
period
年
of
4
time
月
in the middle of
13
the
号
spring break where
这
we
个蓝
started
颜
to
色
see a
绿
lot
颜色的
more
是应该
social
是这
connections
个
and
住院
activity
的
and movement of people, and this has
咖啡
led
色的是
along
死
with
亡
the
的
fact that we
那
have
个蓝颜
higher
色的是这
transmissible
个
variants of the virus
住
circulating
院
in
的
communities
绿
to
颜
a
色的
dramatic
是新增
increase.
数字
We
每
are
天新增
starting
数。
to see a slight blunting
他
of
说
that in the last week
过去
due
从
to
上个礼
the,
拜开始呢，
the
已经
actions
又
that
急
we
速上
took
升，大家看到了。
about 10 days ago. What is also concerning and a lagging indicator is the increase in hospitalizations
所以
that
这
we've
个里
seen
边
in the
也看
past
到
2
了，随着
weeks.
新增的数字
On a
上升了以
positive
后，
note,
接下来
we've seen
跟
a
上来的就
dramatic
是住
decrease
院
in
的
the
数
rates
字
of death,
跟上来。
and
但
that
是
is
呢，他说
important
幸运
as
的
well,
是这个
and is
死亡
testament
的
to how
数字
well the
啪一下子
vaccine
就
is
下来
working
了
at，
这个
protecting
很
people.
表明
And
了
we'll talk a
疫
bit
苗
more
所起的
about
作用。
hospitalizations
所以
and
我们现在
why
要
we're
关
targeting
关
our
心的是
immunization
住院人
programs
数
where
为
we
什么
are
又
in a
上去
minute.
了。大家看到住院人数已经
The
比
next
去年的高
epidemic
峰要高
curve
了。
shows
这个呢是
our cases
我
by
们
health
就是
authority,
看所
and
说的
not
曲线
surprisingly,
了。这个就所
there's
说
a
的曲
large
线呢，
proportion of
各个
cases
颜
are in
色
the
就表
Fraser
示
Health
卫生
region,
局
although we have
最
seen
近
increases
面积最
across
大
the
的这
board
个紫色的就
in
是
the
菲沙
last
卫生
few
局，
weeks.
红颜色的是
This is the
延安卫生
epidemic
局。
curve by source of where we believe people
这
have
个
acquired
这
their
个
illness,
是
and this
如
is
何
by
获
date
得
of
的
onset of illness,
这个
so
是
it looks
如何
slightly
获得
different
了
than what we？
那么
saw
大多数呢都是
previously.
这个国
And
内
as
获
you
得
can
的
see, as we've had
还有一小
this
部分
dramatic increase in
现
numbers
在
of
看来有
cases,
一半不
it's
到的
been
都是不
challenging
明
to
来源的获得
predict where
红颜色
people
的
are
很少，
to
红颜色的
determine
是
where people were
国际上
exposed
获得的
to COVID-19,
深蓝色的
and
是
that
表示已
gives
经
us
查清
also
楚
an
了是国内
indicator
获得的
of broader
而那个
transmission in
淡
the
蓝色呢是
community.
表
It's
示
one of
不
those
明来
things that
源
we look at
获
very
得的
carefully
都不知
about
道哪里获得
if
的
people are having if cases are arising where we don't link them to a known case or cluster, and this is happening more commonly in the past 2 weeks. This is an important slide. It looks at our
他说这
daily
张
case count
图
by
也很重
age.
要，这个是
And
每
as we
7
have
天
seen and
平
been
均
talking
数
about
的
for the last
所以
few
我
weeks,
上
we've
次已
seen a
经说了
dramatic
每天呢
increase,
意义不大，
particularly
因
in
为
the 19
这
to
个
39
统
year
计的
age
时间
group.
多
We've
1
also
小时
seen
少1小时这个数不一样
increases
所以
in the
这个呢
40 to
是7
59
天
year
平
age
均
group
数
and
这个也看出
60 to
来
79 and the
这
5
个
to 18 as
年
well.
龄的
But
分布了
the
大家看到了
largest
吗
and steepest
18到
increase has been in
18到
younger
19
people,
岁是绿颜
both
色
from
的
social connections, but
04
also from work
15到
connections.
18
And we
19 到
know that those
39是绿颜
interact
色
in
的
what we
大家
call
可以看
social
到红颜
networks.
色的是
But what we
39
are
到
seeing
40
is that those
59
social
到60
connections,
是黄颜
people
色
bring
的
it into
这
a
个
home,
已经明显看出来全是这个
where
年龄段
before,
所以媒体里边
if
说
there were
年
10
龄
people in a
年轻
household,
人年轻
we
人其
might
实
see
就是指这一
transmission
段
to
人
2 or 3 other people at most. Now we're seeing, with the new variants in
他
particular,
说
that
主要还是
transmission
变异
can be
病毒
widespread in
那
households.
个传
It
播
may
很
be that
广
all of the household becomes affected,
有可能
and
是指
it's
全家
the
都感染
40 or
上
50-year-old parent
都是
who ends up in
50几岁
hospital.
的
And this
都要
has
住
been
院
played
了
out,
40
particularly
50 岁
in the
的
lower
父母就可能
mainland, but
住
we're
院了
seeing it
所以
now
他说这个病毒
increasingly
可以
in
全
other
家
parts of
感
the
染
province
这
as
个
well.
是从来没听说过了啊现
When
在
we
这个
look at
特
our
征
daily case rates by health authority, we
这个
can
是
see
根
that,
据每个卫
that
生
things
局
are,
的
are
每
really
天新
driven
增
by
数
Fraser
以
Health in
及这个
Vancouver
测试
Coastal.
数
We've had high
就是
rates
新增
across the
数
north for some
除以
time,
测试
and
数
those have
也
been
就是
leveling
检
off
测
and,
率
and coming
阳性率
down. Some some of the other important metrics that we look at
这个飞沙你
carefully
看到
are
吧，
the
也是这
percent
个
of people who are testing positive
下来了之后又
every
上
day.
去。
And that rose quite high to around 12% in the province. It's slowly starting to decrease again, which is good news, but the numbers are still, of course, very high.
虽然他说数字很高，但是呢已经看出来有2个卫生局慢慢下降了。这个呢是根据年龄到4月13号每个年龄组的打疫苗的情况。这个去看到死亡率，下面那个图表是红颜色是死亡明显的就几乎就没有了有些年龄就到了18岁以下就没有了，几乎没有了年纪大的也很少了。那么这个呢是主要是就是年纪轻的人住院的人多了这个是从去年8月份到今年4月份每10万个人里边的住院的情况每天的新增的情况。
In the last few weeks, in
这个也是
particular
年龄
since the middle
60 到
end of March,
79岁
we've also seen a rise in the 60 to 79-year-old age group. That has been the numbers that have been highest historically, the 60 to 79. We've seen a leveling off and a pretty steady rate of people over age 80.
他说80岁以上的这个比率还是很稳定的，就是很有规律。那么20到39岁的呢开始上去了然后40到59岁的已经开始上去了。
So really what we're looking at is hospitalization is now being driven by people between the ages of 40 and 79.
所以现在是40到79岁的大多数人开始住院，全是这些年龄。所以为什么我们打疫苗还是根据年龄这个策略是对的？因为现在住院的还是40到79岁这部分人。
transmission, but very importantly, protects against severe infections, hospitalizations.
所以他说这个疫苗呢，对这个住院以及重症的预防很有效率。
Shows that we are seeing
这个也是年龄分布的这个住院以及死亡。这个今年1月到4月的这个分布情况。 这个也是年
overall with the
黑色
immunization
的是
of
0到
older
19
people,
岁
but we need
咖啡
to
色的
focus
是
on
80岁以上
trying to prevent transmission and illness in that age group continually. Again, this is an updating of the percentage of our cases and hospitalizations, and it shows that we continue to have lower numbers of cases compared to the population in the younger age groups, which is good news. That we have seen an increase in 20 to 29 and people who are sick with COVID, but really the dramatic increase that we've seen in hospitalizations continues to be driven by people over age 50 and people in ICU.
新增案例蓝颜色的是表示这个年龄这个人口这个是我们说的这个基因测序以及这个筛检这个就是要1-2天时间。那么基因测序呢要1个礼拜核酸检测呢要1-2天就能够出来结果。
Over the last few months, since variants were really became an issue that we needed to understand, we have been doing whole genome sequencing to confirm, so that's the only way to know for sure that a variant is one or the other. And we've had a number of tests that have been developed in different laboratories in the province that test for specific mutations. We now know that certain combinations of mutations are associated with certain of the variants of concern. In particular, we have a pretty good screening test now for B117, which is a large proportion of the variants that we're seeing causing disease in BC right now. So we no longer need to do whole genome sequencing on all of the people who screen positive for the B117. We will continue to do a sample of 5 to 10% of the ones who screen positive for that combination of mutations over time. And we will continue to look at all of the people who screen positive for the P1. And the reason for that is the types of tests, the screening tests that we have for other variants look for mutations that are common to many different variants. So you can't tell for sure if it's a P1 or a B1351 just by the screening test. So we'll continue to do whole genome sequencing on all of those so that we're not missing any new
基因检测不对的，他肯定做就是不公布了，因为他们已经很清楚了大多数是117然后呢是 PE因为他说在这个做检测的时候已经看出来各个变异病毒的特征在检测的时候已经看出来事实证明呢，因为这个基因测序呢也要1个礼拜才知道结果但是作为公卫系统的人讲，他们一定要知道117病毒是多少例，这个PE 病毒是多少例所以他们说一定会用这个基因检测来帮助我们了解整个省的发展情况以及各个环境下传染的情况，只是呢已经不再对外公布。同时呢也要关注，即使有些人打了疫苗也会导致感染和生病，到底是什么原因
？And what will show up is this type of information in our weekly surveillance summary that's posted on the BC CDC website every Wednesday morning.
这个是每个礼拜三早上都会在 BC CDC 公布的变异体的情况这个现在呢变异体呢巴西病毒占了49%，英国病毒呢占了50%了，还有呢就是南非病毒很少了。
Of cases in the province are likely a variant of concern versus the other types of other virus strains that are still causing infection. And so that's that green line. When we look at what ones were causing infections in British Columbia, the two that have a high transmissibility are P1 and B117 that are predominating, but it's not equal in every part of the province.
他说这个我们省的变异体的这个规律和其他省还不一样基本上现在英国和变异体和巴西变异体是一半一半飞沙呢不一样，飞沙还是英国变异体多巴西病毒少，延二卫生局是巴西病毒多那个英国变异体少整个省呢是基本上是对半开。
In Vancouver Coastal Health, where we've had a number of different introductions of P1 and transmission chains in different areas of Vancouver Coastal, and in Vancouver Coastal, over 70% of new cases are caused by one of the variants of concern, and the most common one is the P1. When we look at other parts of the province, the proportion of variants causing illness varies and is much less, and it is varied primarily the B117. So this is the information that we are going to be using going forward to help us understand which types of the virus, which variants of the virus are causing illness where across BC. And I want to give a little bit of information of some of the summary data that we put together, focusing on Vancouver Coastal and Fraser Health, the largest school districts, to understand what's happening in our school settings over the past year. So this is an overall graph that shows on the top all ages, so people who've been infected with COVID-19, so that's the overall epidemic curve. And on the bottom in the gray is students between the ages of people between the ages of 5 to 18 years. What we saw on September 10th is the start of school, and then the two gray bars represent the winter break and the spring break that we've seen recently. In both cases, we saw an increase in cases in the community during those holiday seasons. So those holiday weeks, and particularly in the spring break that we've just seen in March, we saw an increase both in overall cases in the middle of that, as well as in cases in young people. And that, of course, has led to increased exposure events in schools when the spring break ended 2 weeks ago. Overall, we still have a relatively low infection rate among school-age children relative to their proportion of the population, and that's particularly true for ages 5 to 12, where it's still underrepresented.
月9号这个0到4岁一共有2113这个是0.207%这个是整个人口的是4.41%那么13岁到18岁一共是6350例这个占整个案子的是6.23%，6.23%，占整个人口的是6.16%那么19岁以上厉害了，19岁以上厉害了那87941了，占了整个案例的86%了这个呢，也就是这个2个学校局他们这个学校里边的这个传播的这个研究调查，那么也是从9月10号到12月18号，然后呢，飞沙呢是从1月1号到3月7号。这个是这个深入调查学生和教职员工是在这个学校里边的传染的情况。
So this is from these data are from the detailed case investigations and contact tracing and outbreak and cluster investigations that are done for every exposure event in schools. So when we look at the findings from Vancouver Coastal Health, we're talking about 124,000 students and staff who were in the school system. So it was excluding students who were homeschooled or who were
去年的9月10号到去年的12月18号这个阶段一共呢是8746例这个里边，所以就在这个阶段整个就是沿岸卫生局是8746例，但是呢总个人口是124000教职员工和学生其中发生阳性案例的是699例，占了小于1%的这个人口，其中55例发觉是在学校里边这个它是着重强调了在学校里边的这个传染情况。那么他也是说到了，在学校这个环境里边呢，一般的情况就是导致了1例或者2例，就是如果这个学校是暴露了，也是导致了就1例或者2例这个是比较典型的一个情景。
That schools are a relatively low transmission environment,
所以他也说，相对来讲，学校的环境下是这个传播率是比较低的。
Effective in preventing widespread transmission in the school setting. This is a summary of the cases in schools.
这个也是 VCH 也是温哥华沿岸卫生局
and staff cases relative to cases in the community in Vancouver Coastal. So the top dotted line is cases in the community, and as we see with the spring break start and stop, we had a rapid rise in cases in the community. We saw that rise as well in student and staff cases, but that has leveled off and started to decrease once school started again after the spring break. It did, however, lead to quite a number of potential exposure events in the schools after spring break. The second study is a very similar analysis that was done in the Fraser Health region, and it involved 315,000 staff and students in the Fraser Health region. And we know that in that period of time we had very high rates of transmission in some communities, in particular in Surrey and North Delta and Abbotsford. Of the 315,000, slightly less than 1%, 2,049 cases of COVID-19 were identified among students, the majority of them students, about 83%, and staff, 17%. Of those 2,000 in some cases, 267, or about 13%, were associated or likely acquired in the school setting. So again, very similar to Vancouver Coastal and aligned with what we saw in Vancouver Coastal in the previous period. And typically when a case was identified, the transmission happened in a school is to one other person in that school setting. And importantly, no transmission was identified in 85% of schools in the Fraser region during this period of time when we know there was high transmission in the community. So again, just representing the
这个也
community
是总
versus
结一下
students and staff
这个
cases,
当
it
中
really
这个
shows
粉
us
红色的也
that
是
student and staff
这个春
cases
假
follow the trends in the community,
那么也是
but that when they're in the structured school environment, the rates of transmission are much, much less. Having said that, it is absolutely 那
clear 么
that
这个也是
every
总结一
exposure
下，它
event
也
is
就是说
disruptive and
学校里
concerning,
边的
and
传
we've
染也是
learned
体现了我们
what
社
are
区
the
的这个
measures
传
that
染
are
的情况
important. We've。
那
been
么学
working
生
with the
和教
schools
职员工
to ensure
传染
that
的
the
情
COVID
况基
safety
本
plans
上
in
都是
every
通过
school
社区
are
和家里
being
里边
followed,
获
that
得的
people，are
而不
doing
是
what
学
they
校里
need
边
to
获
do
得的
to。
那么
reduce
他
the
说在学
anxiety,
校
to
里边
reduce the
就算
probability
是
that
这个
cohorts
传染的话，也就是
and
传1例
even
到
schools
2
may
例
need to be。
那么
closed
学校
for
里边的
a
传
period
染
of
呢
time，
现在来
And
看
that's
不
why
是
it is so
导致
important
社
that
区
we
传染的一
prioritize
个主要
school
的因
staff
素。
for immunization, and starting with the areas with highest community transmission.
那么
And we'll
学
be
校的
working
教
through
职
all
员工
school
的
staff
疫
in
苗
the
计划
province
呢，
over
都
the
是根据
coming
风
weeks.
险高的地区开始
So
施
the
打
key，things
所
that
以
we've
已经
learned
开始施打
is
了，
that
给教职员
COVID-19
工们已
cases
经
in
武装起来。
schools reflect what's going on in the community around them. Most of the cases in the school setting were required outside of the school,
所以他也
and
是
there
说
was
的，孩子
little
们呢，主要还
transmission
是
within the school
在学
itself.
校以外的
So
家
it does
庭啊
not as
社区
well
里边去
appear
获
to
得
be a
传染
major
上的，而
driver
不
of
是在学校
community
里边传染上
transmission.
的。
And I know there's a lot of talk about we need to close schools
所以
to
他说，
stop
我也知道
transmission
了，
in
大
the
家都要说
community,
我们要
and we're
关学
not
校啊
seeing
等
that
等
as an issue.
我们
So
不
this
认为
is
这个是
important
主要
for
因
us.
素
These
在
are
这里
data
边
that we've been
因为
following,
我
we've
们
been
的
sharing
所有
with
的
the
数
school
据
community
证
and the
明了
regular
表
meetings that
明
are
了
happening
这
at the
个
provincial level.
不是学校是主
Because
要
we
传染源。
recognize how important school is for families, for communities, and for children. So reassuring, it certainly is something we continue to pay attention to, and we know how distressing it is when we have exposure events, and we need to all continue to pay attention to what keeps things safe in the school setting. Finally, I want to update on where we are with a modeling that we looked
那么
at
这
on
个
a
就是
weekly
模型
basis
分
to
析了
help us
啊。
understand
那么 RT 如
what
果
potential
是
things
1
could
以
be
上
happening in the
现在
future.
看来
We
所
have
谓的
been
RT 值就
above
是1
1
例
in
传
our
几例，
reproductive
现在
number
看来
for
他
some
说
time, and
所有
that
的
of
卫生
course
局
we
以
see
下
in
都
the
是超
reflection
过
of
1了
the
大家
transmission
可以看
events
到了
that
整
we've
个
been
BC
seeing
省
around the province.
最高的时候是
And this has
1.37，
been
现在到
all
了
over
1.26，
BC.
那么
We
飞沙
have
从
started to
1.32
see
进
a
到
slowing or bending back
1.31，
down of the reproductive
沿岸
number, which
低了，
means
变
that
成
people
1.13
are
了。
reducing those contacts that they
所
have
以这个也
where
是
the
说，希
virus
望大
can be
家能够
transmitted, or
尽
those
量避免接
infectious
触就避免接
transmissions.
触。
And that is important.
所以这
We
个是
saw
很
a
重要
lot
的。
of movement of people and social gatherings
所以他
over
说
the
我们已
period,
经看到了，
particularly
主
of
要
the
是
spring
社
break,
区
that led
社
to
交群
rapid
聚
rise in
群聚，
transmission.
导致了很多的传
That
染。
was fueled, of course, by
这
the
导
fact
致
that we
了疫
have
情的
some
急速上
viruses
升。
that are more easily transmitted,
这个
that are
是太容易的
circulating
传
in
播。
particularly the highly populous areas of the province. We see that in the Fraser Health region,
所以
where
看到了
it's
这个
still
飞沙
the
也
reproductive number still remains high.
还是很高的
Vancouver
案例。
Coastal starting to come
那
down
么
again with
这
some
个
of the
沿岸呢
actions
开
that
始
we've
往下
taken
走
in the
了。
recent weeks. And we see that as well in Fraser, where reduction of even some of those settings where transmission was happening has made a difference in reducing those rates of transmission. The rates, of course, are less stable in the smaller health authorities, the less population, less transmission, but we are still seeing concerning transmission in parts of the interior where Vancouver Island and North are coming down again, and seeing some of the important measures that we've taken in communities in the North having that positive impact on transmission. And finally, looking at where we could go in the future. So right now, the rate of infectious contacts, so the contacts we're having where the virus can be transmitted to others on average in the province is somewhere around 55 to 60%. That is too high. We know what we need to do to bend that back down. We need to get down to 40% or less, and we have done that consistently. We were able to do that last March. We did that in November when we put in restrictions again. And I want to remind people the restrictions that we put in that worked in November are still in place.
但是现在所有的限制令都是在有效的。
have some of those social interactions
这个
again,
特
and
别是
perhaps a
社交
sense of
大家的
complacency
这
around
个
those.
行为
We
上
need to pay attention
要谨
again.
慎。
We want to be able to have interactions and connections, whether it's for work, whether it's for school, whether it's for
我
those
们一定要搞
needed
清楚
social
我们是
connections in a way that is
接
safe.
触的是
And that
因为
means
是学
following
校的
COVID safety
还是
plans
因
in
为工作的
workplaces.
还是因为
And we
社
are
交要需
focusing
要
on
的
those
我们一
workplaces
定要
where there
安
has
全
been
一
transmission,
定要考虑到安
where
全
those COVID safety plans have broken
那
down
么
in some
对工作
cases.
场所来
And
讲
we
呢，我
know
们
that
还要
part of
已
what we
经
need to do to break those
WorkSafeBC
transmissions is
这个组织跟我们已经紧密合
to shut
作，也是对
workplaces
各
for
个
periods
工
of
作
time
场
so
所
that ongoing
加强
transmission to that
卫生
next
措施的
generation
检
can't
查以
happen.
及督促。
As well, we know that that travel and traveling
那么
for
同时
social
呢，也是
connections,
看到
for
了这个旅
recreation,
行
for vacation,
这
for
个
those social
度假
interactions
以
are
及
settings
这
where
个
we
社
have
交
seen
已经看到了这些
transmission
导致
happen
了
very
传染的
rapidly and
快
move
速的
back
传
into
染传
communities.
播
So
病
now
毒
is our
然后呢把这个
opportunity
病毒呢又带回社区
take
带
a
回
step
来
back again
所以
and
希
get
望大
us
家
through
还
this
是要往
next
回
period
走
of time as our
那么
vaccination
等疫
wraps
苗
up
打
once
完
more.
等一
And
定
we
的
can
时候
see that
再
it's not the
考
same
虑这些
everywhere
事情
in the province, although we are all
那么这个也
facing
是看到
the
了，就
same
是
storm
每一
right
个
now.
我们全
And we
省
need
已经
to
就是
make
一样的
sure
话，
that we're
就
all
是各
taking
个卫
those
生局
actions
都
to
是这样的
keep
一个情况，
ourselves
没
and
有
our
这个世外
families
桃
and our
源
communities
这个
safe.
也就是说各个卫生局，也就是同样的40%啊，50%啊，60%，
Finally, I'm
也
just
就
going
是
to
说，
remind
如
people
果你
that we
正
do
常的
have
社交是
our
100%，
population
就是你
health
天天去
survey
泡酒吧
round
的，
2
那你现
that
在
is
就
open, and
10天里面4
please,
天去泡
we've had
5
about
天去泡酒吧
85,000 people
6
who have
天去泡酒吧，
responded,
就这个意
but this
思。
is your opportunity
这个
to
呢就
tell us
是
once
我们
again what are the things that are impacting you
这个
most
是
here
我
in
们的这
BC.
个第2期的这个
So
民意调查，
together,
希望大家能够
all of
积
the
极告诉
metrics that
我
we've
们
presented
那
tell
么
us
现
some
在已
very
经完成
important
了
things.
85,000人完成了我们
The
的民意调
people
查
that you are seeing every day,
4
whether
月
at
13
work,
号为止
whether running errands,
所以
going
也
for a
请大
walk,
家能够分
it's
享你的
likely
想法，
that
也
without
是积
you or
极
them
的
knowing
参加
it,
我们的民意调
somebody
查。
in your community, in your connections, has COVID, may not be aware of it, and is potentially infectious. The more people you see, the higher that
所以
likelihood
他说
would
你
be.
见到的人，你
Right
根本不
now,
知道
we
他
have a
连
lot
他
of
本人都不知道
transmission
他
in
有没有病
communities
毒
across
感
the
染上了，
province.
所以你见
So
到
what
的
does
人越
that
多，
mean?
你风险越多。
Even
所以
if
这
we
个也
can
就
see
是
people
这个也就
outside
是
our
说
household,
就算
we
你
shouldn't
你在
right
室内
now.
看或者室
And
外
if we do,
见到更
it
多人
needs，to
也
be
希
the
望大家
same
不要去
small
见了
group of
啊。
people.
就算你必须要见，
We
那么
know
希望
that
大家
outside
见
is
少一点
lower risk.
啊。这个就
It's
是
not
风险
zero,
存在在
but
那
it is lower risk.
已经
So
是在
have that
室外
small
就
group
算
of
是有风
people
险，但
that you
相对还
meet
低
with,
一
that you
点。
need
那么
to
人少
support
一
you.
点，相对
Meet
风
them
险就低一
outside.
点。
Keep your
我
distance.
们
If you're
我
going
们
to
也
be
希
in
望，就
close
算在室外，也
contact,
是
wear
需要
masks,
能
even
够
if it's
安全
inside.
距离
Each of
如
us
果
has
是不能
less
保证的
contact
话，
with
请
people
大家戴
around
口
us.
罩。
We will all see that benefit.
我们都看到
Even
了
a
去年
small
过来了之后
effort can make a big
哪些
difference
做得好
in
的
our
给我
overall
们带来的
risk
好处
in the province. I know many, many people
我也知
have
道
been
很
very
多很多人
diligent and
已经
committed to
很
following
勤
the
奋、
public health
很谨
orders that
慎
we
的
have in place.
遵
But
守
we
我们
need
的行为
now
规
for
范
all of。
那
us
么是
to
我们
get
要希
onto
望
this
每一个人
path.
都要遵守行为规
And I
范
want to，
都
thank
要
people
遵
who
守
are doing。
我也
that.
感谢大家。
But our future path
我们
is in
的
our hands now.
我们
We know what we
将
need
来
to
就掌握
do.
在
We
我们
need
的
to
手
stay
上
close to
我
home.
们
We
希
need to
望能够在
stay
家就
small.
在家
We need to
我们
stop
如
those
果拒绝
transmissions
拒
that
绝
are
人少
getting
就拒绝人
between
少我们一定要
that we're
停止这
spreading
个病毒
between
的传
people
播
and bringing it
我
home
们一定
to
要
our families,
不
our
阻止
workplaces.
这个病毒带到
We
家
know
里
that
边去
COVID-19 is a virus that's
同
transmitted
时呢
by
我们的
people
工作
to
场所
people
也要
and to
安
the
全
people that we are closest with. This is our third wave, and we
那
have
么
done
我们
this
现在已
before,
经面
and
临
we
第
can
3
do
波
it again.
这我们从来没有
I'm
经历过
asking
这么
everybody
这么
to
高
do
的一
our
个风
part
险
today
我请呼
to
吁大家
remember
从
that
现
we
在开
have
始
it
做
within us
啊
to
我们
take
一定
these
要从自我做起做一些小小的牺牲，每天做一些能够一起度过这个困难的事情。你不是单独一个人在战斗，我们每一个人都在战斗。我们一定要争取时间，我们一定要结束这个医疗击垮的这个状况。我们一定要保护我们的医疗资源保护我们的家人。 保护我
that
们
we
的老
need to
人。
do this in this most challenging of
我
time
们已
by
经知
being
道这个
kind to
困
each
难
other,
很
by
困难的时候
remembering that we
我
all
们一定
have
时刻记
the,
住
the issues that we're
我们
dealing
已
with
经
in
受
our lives, and we
面
may
临的
not
困难，我们
understand
失去了
everybody's
这么多的
story,
生命，
but we all know what we need to
我们
do
已经知道
today,
我们该
and
如
we
何
will get
做
through this storm
我
together.
们一定度过这个风暴如何安全的度过这个风暴？谢谢大家。那么卫生厅长可能会讲就是工作场所的情况吗？我不知道，因为他事先发了2个文件。
Thank you very much,
谢
Dr.
谢大
Henry.
家。
I just want to,
那
on
么也
behalf
是
of,
说了这个过去
of the Premier
新
of the
增
government
的
and really of
3
everyone
个
in BC,
3 例
pass
死
on
亡
my condolences
也
to
是代表省长
the families, the
对
friends,
这
the
些
caregivers of the 3
新
people
增
who
死亡
passed
的
away
家
in the last
庭
24 hours from
亲朋好
COVID-19.
友
This
这个
is
表示诚挚的哀悼
a difficult time in the
这个是
pandemic
对
and
你们来
obviously
讲都是
with
困难的
the
等等
limits
等
on
等
our ability to come
那么
together
不是所有的
to
网友都刚
celebrate and
从一开始
acknowledge
听
and
我们的
grieve
节目
about the ones
我
we've
再
lost.
汇报
It's
一
a
下
difficult
在过去
time. We're
24
with
小
all
时
of
里
those
边
families
也是4位数
and
新
caregivers
增
today.
1205
I
人
wanted
那么
to
本省呢
note
目前累
with
计已
respect
经
to
到了
vaccines, I'll
11
just
万
be very brief today,
6075 个人
that,
其中呢
as Dr.
两岸
Henry
是
said,
301个新增飞沙是730个新增这个岛上是38个内陆是69个北部是66个还有1例是国际上获得的那目前为止住院已经409例了重症监护是125个很可怕了那么到昨天为止呢已经有128万刚才小插曲我们的卫生官那么英文里边那个数字绝对不如我们中国人方便所以他就少说了一个他说12万他说对不起是128万5600多个人已经接种疫苗
Moderna vaccines that we expected. To date, we've delivered 902,766 Pfizer, which is, just to put that in context, all of the vaccine that was provided, every single bit of it that came before Monday, Tuesday, and Wednesday of this week, and a significant portion now of that which we were provided this week. So
那么这个也是卫生厅长汇报了我们这个货礼拜1、礼拜2、礼拜2、礼拜3到了多少的这个辉瑞，到了多少莫德纳和阿斯利康的疫苗。那么现在呢，阿斯利康呢已经有78000次600多78600多32针呢已经部署到各个这个药房大家符合这个年龄的都可以去打了。
I want to briefly update you. We'll have a more significant update on hospitalizations in detail for people in our briefing on Monday. But in terms of overall hospital occupancy, our base bed occupancy is 92.4% across the system, meaning 714 vacant base beds of our total beds, which includes
这个很厉害，92.4%了。我们一定要清楚，不是所有的新冠病还有很多人有其他病要住院。那么，所以现在病床占用率是92.4%了。
We have our base bed occupancy in critical care is 80.5%, meaning we have 105 vacant base beds. And in total, the total occupancy when base and surge beds are added, some of our surge occupancy capacity, about 3% province-wide. And as all of you know, the challenge is not equipment. We have a considerable supply of ventilators, and we are not touching in any way our ventilator capacity or our bed capacity. But what it does happen, of course, is when we move into surge beds, it puts significant additional pressure on staff, and that is, of course, an important question. I'd note
他也是说到了因为这个住院人数的急速上升，给医护人员造成了极大的压力，工作上的负担很大那么也是说到了呼吸机的问题，呼吸机的这个资源现在也是紧张。
This is not a high level in comparison to pre-COVID times, but obviously with COVID-19, the pressure on our staff is considerable. I just want to note that more than 1 million people have registered since we launched our registration system for vaccination. 1,048,547 people, to be precise, have registered, and 362,857 have booked appointments. I want to encourage everybody. People who have
所
not
以
yet registered
现在已
from
经
60
还有
to 64,
36万
for
的人呢，
example,
已经
people who
有
have
预
not
约
yet
了。
registered
那么我
between
也是
50 to 60
鼓励
in
60到
BC to get
64
on
岁年
and
龄
to
段的人
register,
赶
which
紧
will
来
allow
注
you to
册
book an，
先
appointment
来
at the
先注
earliest
册，
possible
因为
moment
现在呢
when
已
an
经
invitation
50岁以
is
上的
sent
人
to
从
you.
明天开始都可以
In
注册了
closing, I
注
just
册
want
完
to
了
say
之
that
后
with
政府会给你预约。
26.7%, now over
那
1 in
么现在
4
呢，已
eligible
经有
British Columbians having had
26.7%
their
的
first shot of a
26.7%的人，
COVID-19
也就是
vaccine.
说超
We're
过
going steadily in
4
the
个
right
人里
direction
边
on
有
the
1个人已经
vaccination
打
front,
了疫苗
and
了
our teams are doing
这个不
an
是总人口
exceptional
啊，
job.
因为孩子
But
们
we
不能打
are
疫苗
not，
所以
yet
大约
close
是
to
能够打
community
疫苗的人里
immunity to
边
keep us
1/4
safe.
的人已
It's
经打
still
了。
us and
那
the
么他说
vaccines
这个
against
跟群体
COVID-19.
免疫
For the
还远
vaccines
远
to
不
do
够
their
这个
job,
水平，
we must
所
do our
以
job to
我
stop
们
the
一定
spread.
要这个
And
每个
Dr.
人还
Henry
要
made a
谨慎，
very
一定要
important
做
point.
自己分内
We've
的
had
事，来阻止
significant
病毒的
orders in
传
place.
播
We were put in place in November.
我们也是
made
发布
more
了这个
made
很
more
重要的卫生命
made
令
tougher in December.
那么我们
And
现
now
在的卫生命令呢
have
是这
additional
个
measures targeting
比11月份的更加严格，
social
更加
gathering and
这
social
个
connections. This is
这
a
个
this is
严
a
厉，
virus
所以
that
这个
spreads
是
through
就
social
希望大家
interaction.
能够
And
在
we
这
must
个
do
社交
everything
方
we
面
can
能够
right
自我
now,
约束
these case
能
counts,
够约束
to reduce our social interactions
希望
and
大家能够
focus on
减少
public
这
health
个社
measures
交的
and
活
the
动
public health guidance we've seen,
也是
and
遵守
we
我们
can
的
do
卫生
this
指令。
together. In the last few days, we have seen a decline in case
那么过去
in
几
our
天呢，我
test
们已经看
positivity,
到了
but it is
慢慢下
nowhere
降
near
的
low
新
enough.
增，
We
但
have
是
a
我
long
们现
way
在
to
远
go
远
together.
没有
I
到
want to encourage
拉平
everyone
曲线的这
to
个地
use our
步，
COVID
所
skills
以
without delay
我
and
们已
without
经都
fail.
知道
We
如
must do
何
what
应
we've been
对
taught,
这
we
个
must
新
do
冠
what
病
we
毒
know
的各种
works,
技
and
巧
we must,
技
must
术
do，
我
what
们
we
也
know
是
it
知道哪
takes
些
to
行之
stop
有
the
效
spread.
哪些无效，所
Aujourd'hui,
以我
nous
们
avons
也是希望大家能够行
100
动起
nouveaux
来
cas。qui ont testé positif pour COVID-19, pour un total de 116 075 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 pour un total de 1524 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 409 personnes sont actuellement hospitalisées, dont 125 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First, we go to Binder Sajan, CTV.
Hi there. Just wanted to go back to the data from schools. I know
这位记
both
者
the
对
Fraser
这个
Health
学
and the
校的
Vancouver
数据
Coastal information seems to be
穷追
coming
猛
from
打。
before variants of
他也是
concern
说到了
really
延安
took
卫
hold
生
in
局的
BC.
信息提供的。
So, given how transmissible those are, more so than the regular COVID-19 virus that has been in BC, is there a greater likelihood that we could see more transmissions happening at schools?
能不能说这个学校，因为
I
你
will
这
say
个延安
that
卫生局是
variants
分
were
析的
certainly
是
part
去
of
年
the
12月份之前的数
equation,
据，那么
particularly
现
in
在
some
这
of
个
the
学校
school
的
districts
传
and
染情
Fraser
况是
Health
不
during
是
the period
更
of time
加
of the
更加严
Fraser
重？
Health review.
那么他
And
说，
we've
这个
done,
同
as
期
you
的
know,
1月份到
a
3
lot
月份呢
of
是菲沙卫生
extensive
局做了
testing
学
when
校的
we've
这
known
个
that
传
there
染的
was
情
a
况。
variant of concern exposure event in a school, and we have not seen increased
我
transmission
们没有看
related
到
to
这
that in
个学
schools
校
to
里边
date.
的传染
That
的
is
增
something
加
we are
情况。
watching. We are assuming, as
我
I
们也是
mentioned,
在积极的
that
观察，
all
密切的观察，
that any case
所以我们也
is
是
B117 now. So
也
we
是
are
看到
taking
了
the
这个
same measures of
117，我们也是假
ensuring
设，
a broader
我们也假设
ensuring
这些
adequate
117
contact
病毒，
tracing,
也
immediate
就是
contact
英国
tracing and
变异
testing
体
and
病毒，
monitoring
他
of
们获得
families
都是
and
英国变异
and
体
close
这样
contacts
的话呢，就是
related to that. But we've not seen increased
我
transmission
们
in
没
the
有
school
看到这
environment. Again,
个学
you
校
know,
里
it
边的
talks
增加
to
的
the
新增案例。
importance of safety measures
所
and
以我们
structured
认为这
environments
个主
being
要的安
less
全措
risky
施
than
在
some
这
of
个学
the
校里边的
unstructured
落实
social
到位
connections
是
that
更
we
加重
have.
要，以
But
及
it is
呢，
something that
我们
we're
认为
watching
这
obviously
个
very carefully.
这个
Binder, do you
限
have a
制
follow-up?
社交活动
Yes,
是
and Dr.
最重
Henry
要
in
的。
BC,
当
we've
然，我
learned
们
that
还是在
hundreds of
积极
people have
小心
tested
的密切
positive
观
for
测
having at
学
least
校
one
的
dose
传播
of the
情况。
vaccine. I'm wondering if you you also happen to know how many people may have died after contracting COVID-19, even if they've had the vaccine? And, if that falls into your expectations, And just wondering,
他说，从你疫区的来看，就算有人打过了一针疫苗，会有人死亡。你认为有多少这个数据是合理的？就是你期望是这个合理的数据。我们现在把这个疫苗以及新增的数字都联系起来，都看他们之间有没有联系。那么过去几天我查了一查。我们现在发觉有400多个人感染了阳性，所以相当是0.7%，也就是很低的这个感染力，所以这个也是好消息就是14天以后有人打了第一针14天以后，现在有400多例，那么他说是0.7%，这个很低的。
It's in the 30s cases of people who have tested positive, become for COVID at least a week after dose 2. So that's 0.04%.
所以我们现在已经有看到30岁左右的也有10几例30几例说错了，不是30几岁，30几例是打过第二针1周之内发觉阳性案例了。但是他说这个比例也很小很小因为大家可以看到了，现在打了已经128万。
That's great.
那么现在才30几例、400几例这个都是很小的。
Immunized and developed COVID afterwards, but I have not had the latest numbers. I know
但是他说死亡好像没有，就是说获得疫苗之后去死亡的这个数据现在暂时还没有。有一例在长期护理院就算打了疫苗之后也是100岁以上了。哎呀，100岁的老人。
Next, we go to Richard Sussman, Global News.
100岁的老人有一例打了疫苗死亡的。
Dr. Henry, you mentioned
是不是打疫苗死亡，是打了疫苗之后仍然死亡。
In place now than we did in November and December when we started to see that curve go back down.
那么他说，你们现在所采取的限制措施又回到了11月、12月。那么11月、12月呢，的确数字下降了。那么看不看现在这个措施会数字带来好处？
The thing we need to remember is
the variants
are more transmissible,
but the things that stop transmission are the same. So it is about the number of people that we are in close contact with without using our protections. So that means indoor environments are riskier than outdoor environments. We have larger numbers of people. If we're talking loudly, if we're singing, if we're in a poorly ventilated area, those are riskier situations, and there's no margin for error right now. So it means that it's more likely that you're going to transmit to more people in those situations. So it doesn't mean that the situations and the things that we need to do are different. It means that what we're seeing is you're transmitting to more people when you're doing those things that put you in that risk situation. So your probability of being exposed to somebody is higher now because we have higher rates of transmission in the community. So if I'm seeing a group of 10 people, the probability that one of them has the virus and is potential to spread it to me right now is highest than it's ever been. So we need to pay attention to what we know works to prevent those transmissions. And that means staying small, staying outside, wearing masks, being in, keeping our distance from people. The things that we know stop transmission have not changed. What has changed is our risk has changed because this virus is transmitting more easily. So we have restrictions on indoor gatherings with your household only. We have restrictions on numbers of people who can be in a business. We have COVID safety plans that work, but they need to be followed. And that's one of the reasons that we put in place the protocols that we now have with WorkSafe so that we can target those specific businesses where this is happening and support them to prevent transmission. It also is why we've had to do things like reduce some of those situations that were okay even a few months ago.
indoor dining was a structured
他说一个
environment
月
where
之
there was
前，
some
就算是
risk,
一个
but
月
the
前还
risk
是
was
OK 的，就
low
是在室
low
内
enough,
大家
and
吃
now
饭
it's
因为那
higher
个风
because
险
of
高
the
风险
variant. So
低，
that
但
is
是
one of
因
the
为现
reasons
在
why we
变异体来了，这
moved
个
and
室内吃
mitigated
饭
that by
就风
having
险很高
takeaway
很
and
高
outdoor
了，
dining
所以
only. So the risk is not zero
所
if
以
you're
那
sitting
么
on a
现在呢，只
patio
能鼓
with
励在室
somebody
外
right
吃饭
now. The risk is
所以
less though than inside, and we were seeing
所以那个室外的
transmission
风
to
险
larger
相对来
numbers
讲
of
还是
people
比
in
室
those
内少
inside environments. So it is the same things, but we
因为
all need to
其
be
实
doing them now. And really
是一样一
importantly,
回
we
事
saw a，
只
lot
是
of
呢，现在
people
变异
moving
体
about.
的
And
风
then
险
when we
更
move
大，
about
这个
and
更容易
have
传
contacts
播。
with people in another place, we're bringing the virus with us, and we're bringing the virus home with us. And that's where we saw spread of transmission across the province.
我们已经看到了，就
Richard,
是
do you
这
have
样
a follow-up?
的病毒就是这么传播啊，这个
Your
带
dynamic
到社
model
区
in
又
here
带，
shows
因为
if
你
we
在外面
continue our
又
current
带回来，
contact
带到
behavior,
社
we're going to
区。
be hitting close to 3,000 new cases a day by the end of April. Right now, at 1,200 new cases a day, we are seeing hospitalizations at record-breaking numbers. So if we don't amend our contacts, what does that mean for our hospitalizations? And also on a side note on vaccinations, now that we're aiming towards vaccinating school staff, police, and fire, how much of that Moderna Pfizer is being moved from the age-based to those priority groups that you've committed to
然后呢，
vaccinate?
他又说到了，因为
Yeah, so,
AZ 的这个问
in
题，
terms of
因为给这些
hospitalization,
年
yes,
龄
it's
不
a
能用
lag，
那么
indicator.
只能是
So
用
we
辉瑞
know
和莫
that
德纳。
as
那么
rates
有
go
多
up,
少已经给了这些
5%
必须工作
of
的这些
1,000 is
first
more than
responder？
5% of 400. So we will see hospitalizations, and that's why the age-based program is so important.
他
Why
说
we
为什
need
么
to
我们还是
maintain
以
the
年龄
protection
为
from
主要
vaccination for
的施
people
打
down to
的这个
age
策
40
略
in
为什么
particular?
重要？
But you know
因
they
为
all
这个疫
converge
苗
at one point.
能够有效的
And
阻
that's
止
why
这
we've
个
been
重
targeting
病
the
以及死
AstraZeneca
亡。
that we have to anybody over age 55
那么现在
to
呢，
try
只要
and
是
increase
55
our
岁以上的
protection in
得
that
打
lower
那个
of that
那
age
个
group.
阿斯利康。
And in
那么
terms of, we have always had a stream, a parallel stream that we have used for outbreaks and for management of clusters and cases in different communities. So it is from that part of the stream that we're using to continue the worker program that we'd started. So it's a very small percentage, about 10% of the overall product. So it's using the AstraZeneca to supplement the age-based program, recognizing that we will all get there and we have more vaccine coming. It just wish we had it today
那
as
么伯
opposed
尼
to
就给大家
in
鼓气
May
啊，
and
我们知道
June.
有
So it is
那个
a
会有更
spacing
多
out, and
的
that's why
疫
we've
苗
had
会
to
来。
do this by area of risk. So not every school, not every fire service will be done this week. They'll be done phased in over the next few weeks.
啊，那么不是这个
Next
所
week
有
of
的
Elisa
学校
Houston,
以及
News
所有的
11:30.
这个必须打的这个工作场所的first
Hi
responder
there.
这个礼拜完成
I was，
但
listening to the Ontario,
最晚也就是下个礼拜都能
Dr.
给他们
Babbers,
打完
yeah,
了
he's saying that they are in a
啊
very，
因为我们
dire
他说我们
situation. You mentioned that
因
we're
为
about a month
有
behind
更多的疫苗已
Ontario.
经
So
来
are
了
we doing enough here to
啊
prevent，
同时
our
呢
very dire
他们在这
situation？
个跟年龄有关的疫苗打的人施打以外呢，还留了一部分同时平行进行的，就是这些疫苗是给高风险的社区以及这个必须是工作的人员，比如说教师啊、救火队员啊、警察，已经这一部分也留给他们打，都不影响的。
So it was really only in reference to the proportion of variants of concern that we were seeing in our cases every day. We are charting our own pandemic, and we've said that from the very beginning. We've seen that across the country. There are different population dynamics. There are different population demographics. There's different types of transmission events and super spreading events and introductions that are happening in different parts of the province. So Ontario has been hit hard, and they had
他也是说到了 BC 省跟其他的省份还有点点不一样，我们本省的这波疫情还跟 Ontario 还不一样。那么我们也是很紧密的仔细的观察。那么我们现在的策略还是主要是支 支援我们的这个工卫工作人员到处的去灭火啊。
Monitoring them regularly. We have the metrics that we are using.
我们也有自己的观测检测的方法以及这个数据系统
pressure points are happening in the hospital system, and we saw that in the last few months in the north, being able to decant people who needed care out of the north to other places, and recognizing how challenging that is both on families who have a loved one who's sent to Vancouver Island, for example. But yeah, this is something we're paying attention to in a huge way, and why we put in the restrictions that we put in, why we're focusing on the measures that we need to do in communities to prevent transmission, to reduce the risk of people needing hospitalization. So it's all looking at what we
他住院就是有效的阻止你没办法了，你阳性就阳性了，不要去住院了这个有限制很多的措施。
And families saying, when a kid is sick or a kid has to isolate, other people are able to continue going to work. Is that too risky now?
And so there's a couple of things around that. I'll answer your second question first. Yeah, we have had a lower tolerance for if somebody in the family is ill, because we're seeing it spread so rapidly in families in particular in households, that yes, keep the children home from school if somebody's sick. Get tested. Make sure we know what is happening. And the case management contact tracers are doing that. So every situation is a little bit different. It depends on what you do for work, for example. What the risk might be. But yes, it is right now. If somebody in the household is sick, then everybody needs to pay attention and make sure they're getting tested, that we understand the transmission in those environments. So we have a much lower threshold for staying home if somebody's sick in the household right now and not sending children to school. I've said that a couple of times because of the rapid increase we saw in a lot of social interactions that were happening over the spring break. In terms of hospitals, the models give us a sense of what are the parameters that are most important going forward. It's not a prediction. It's not a prediction that we're going to have 3,000 cases next week. And we've not seen that happen in other models that have presented in the past. It helps us look at what are the things that we need to adjust and where we need to go with those. So, we put in additional restrictions. People are paying attention, and we are reducing the transmission in our communities. We've seen that a little bit, and we are looking at the hospital plans across the province, and we'll be talking more about that on Monday in some detail.
Next, we go to Dax Panwar, Red FM.
Hi, Dr. Henry. Thanks for taking my question. I was wondering, a lot of flights are coming from India, which
这个先生问的就是印度来的很多航班。
There are a lot of cases of exposure.
他说有很多的是感染的。
Have you seen any case? Have you noticed any case?
你有没有这个分享一下或者看到了这个从印度过来的这个双重变异体的病毒传播的案例？
Off the top of my head, I know we have seen a number of different variants. I presented some of them last week.
他说上个礼拜呢，我们已经看到了很多的变异体的这个情况。
We have a lot of flights that are coming from India.
我是关注很多的从印度过来的航班。
And we know that that's part of the federal government's quarantine
因为这个呢，有些就是联邦的检疫措施。
appealing to people to make sure that you support your friends or family if they're coming to visit you, to make sure they are quarantining appropriately, that they're isolating appropriately. We have a small proportion of our cases every day that are related to international travel. That's something that is always a concern. We know that flights need to come and go for a whole variety of reasons, but it is something that can lead to introductions of new variants, and that is why we've modified
所
our
以他说我
surveillance
们现在
strategy
也
to make
是
sure we can
也
pick
是
those
不断
up
的
as
修
well.
整我们的这个监
Jax, do
测
you have a
系统、
follow-up?
监测方法。
Yes, I do. Thank you, Dr.
监测不是检测，
answering
也就
that question.
surveillance， 也
My
就
second
是
question is, you
监
had
测
said
国际旅
that
行来的。他说
we are
我们也要不断的在
testing
修正
bamlanivimab
因
in
为
certain
国际
hospitals.
旅行
So
一
any
定是
update
我们
about
关注
that?
之一，但这里边呢，因为
I'm sorry, I
那个
didn't
都是
catch
联邦
something in
的
Surrey
检疫
Hospital.
系统在做这些事情。
Bamlanivimab, the
Bamlanivimab. Yes. It's funny, I was just talking with the clinicians who were leading that study yesterday. It has been a challenge to enroll people into that study, but I know that they've got some and are working on that. I don't know the
有一
results
个
off
这
the
个
top of my head,
Limabab 不
but
知道
it
是
is
什么一个
being
项
run by
目
that we have a
那么
clinical
希
care
望就
reference
是大
group
家他
that
说他
ensures
是的确是
that
有一个有一
that
个
new
有一个
investigational
项目在
therapies and
那么
other
希望大
therapies
家
that
来
are
积极参
available
与
are done in a way
这
that
个
we
也
can
是
understand
让
their
大家
effect.
能够
And
调查
I know they've enrolled a number of people, but are having some challenges.
Next, we go to Colton Davies, Radio NL.
Hi, Dr. Henry. You said in your early comments earlier that we shouldn't see groups of people right now, and if we do, we should make it small. So I'm just wondering, why not amend the order then for outdoor public gatherings with up to 10 people?
Yeah, you know, as
他
I
说
said,
我们
it's
现在
about
不是
finding
说
those
要
ways
见
to
少
do
的
it
人嘛？为
more
什么你不能
safely.
修改？
There's no
就
zero
是
risk right now.
10个人
It's,
现在因为
it's-
室外还可以
we're
见
seeing
10个
this
人，为什么
virus
你
being
不修改？
transmitted in lots of places. But
他说
we
我们
know
的确
that
看到了很
the
多地
order
方
is
在
about
病毒在
indoor
传染
gatherings because
主要
those
还
are
是
the
室内
riskiest
室
settings.
内的这个环境太
I
危
do
险
think
太
it's
风险
important for us to go
所以
outdoors.
我是觉
And I
得这
think
个
all
还
of
是
us
希望
should
大
be
家
going
能够走
outdoors
外面
every
去
day and
我每天
making
去鼓
sure
励大
that
家
that's part of how we
走
keep
室
ourselves
外
together
去
through this never-ending
这个也
pandemic, it
是
seems. But
就算不是在这
yes,
个
it's
全球
an
流行病
opportunity
也
for
是
people to
要
have those
多走
important
室
social
外
connections
这
in a
个
way
对
that
对
reduces
人们
the
来
risk.
讲这个
But it
社
should be
交
the
社会的
same
联系
small
还是
group
很
of
重要
people
的但
that
是
you
呢
can
人
meet
数越少风险越
outdoors,
小
keeping your distance. And if you're
就
closer
算是在室内的
together,
话
wear
呢
a
你要
mask.
距
Colton, do
离
you have a
要
follow-up?
保留距离保持距离不能保持距离
Yes.
戴口罩在室外他
With
没
the
回答
modeling
为什
today,
么
it
没有
shows,
修改10个人
clusters of
那么你可以说
COVID-19
6个
in
人
workplaces
现在还没有还是10个
primarily
人
the lower mainland. It doesn't show interior health, northern health, or island health. And I know you've made clear that the risk of the virus applies everywhere in BC. So I guess the point of my question is, can you explain the extent of COVID-19 clusters in workplaces within interior health?
那么他说内陆的工作场所的变异体的传播情况你没有说因为我刚才说了他们就发了2个文件一个是工作场所的传播的这个文件但是呢就说了2个一个是温哥华一个是飞沙卫生局没有说到内陆那么他希望这个记者让他公布一下这个内陆的工作场所的这个零星爆发的零星的案例的这个分析
Coastal. So it has not been collected systematically in other parts of the province, but yes, it is happening, and we know it's happening in the interior. We're seeing workplaces, particularly in the urban areas where workplace risks are slightly different, where there's more people, and that's why things like the indoor dining restrictions apply across the board in the province. The numbers of workplace outbreaks and clusters are much smaller in areas outside of the lower mainland, with the exception of some of the large industrial complexes and mining complexes both in the interior but particularly in the north.
特别是北部地区更少主要呢那个工人呢那主要是在吃饭引起的传播那个他说了这个矿工这些北部地区主要集中在工作场所的传播主要是这个吃饭引起的
Sorry, my apologies. Dr. Henry, we've seen some modeling from experts released yesterday that we're going to overflow hospital capacity if BC remains on the trajectory you outlined today of reaching about 3,000 cases in the next month or so. What is the province doing, / why is the province not doing more to reduce the social gatherings, to reduce
那么他也是说到了为什么现在一周要新增3000多例以上，那么那个住院这么多人，为什么省政府没有采取行动去限制人们的社区这个聚集人群聚集？
That we are seeing some impact of the measures that have been put in place.
他说我们已经看到了这个限制措施所产生的效果，但是我们也看到了这个限制措施产生了影响。
But they are just that. They're models. They tell us what
模
are the
型就是模
important
型，他
factors
是
that
说
we
了
need
模
to
型
look
只
for.
能
They're not trajectories. They're not predictive. And we also need to put that in the context of what are the measures that we know are feasible and effective in our communities and that will work. So yes, we have said absolutely you should not be traveling now. And I said neighborhood the other day, but you need to stay in your local community. Go outside, but go outside in your own community. Traveling is what spreads the virus and what leads to transmission events and chains of transmission that move around the province, and we've seen the impact of that. Those are important things to pay attention to right now. We have orders as well around indoor gatherings. We've had restrictions in workplaces. Those are having an effect, but we cannot let up right now. And we're saying the same things as the modelers are saying, that we need all of us collectively to reduce our infectious contacts, so that's reducing those indoor contacts where we're not using masks, where we have poor ventilation, where we're not keeping our distance. That is something we all need to do
这个
right
是
now.
如果是在室内通风不好，也要戴口罩这个是我们
I
必须
do,
现在要
thank
做
you.
的。
And as you noted, Dr. Henry, a lot of the restrictions that are affecting people's day-to-day lives in terms of social gatherings have been in place since November. What exactly are you and is the government doing to signal the importance to people when really a lot of the restrictions are on travel, as you mentioned, are advisories? What are you doing to signal the importance of following them now when it's clear that transmission is happening, because people haven't been doing that for the last few months or so?
Well, I think we need to recognize that people were following and are following for a number of months. And yes, we saw that there was some people who felt that they didn't need to adhere to those anymore. And it's hard. We're in that hard period. You know, we have longer days. We want to get out. It's hard that we're going through this again. I think for a lot of people, it's that sense that this is never ending, and we need to. We have this sense of denial or acceptance of things, but it is a wake-up call to us in this last few weeks that these things are important. We're seeing it now affecting our healthcare system. We're seeing it affecting families and communities, and the impact across the province. We look at places like Whistler. We look at places like Prince Rupert. You know, this is a different game right now. The restrictions, this concept that we're in the end game and we can let things go and we can make exceptions for ourselves are things that we all need to pay attention to again. We know that we can stop this virus. We know that we have things like vaccines on our side, so that the end is coming, but we're not there yet, and we're going to see the impact tragically on the people we're closest to if we don't pay attention to it now. I'm not sure who was it that said that hard things are hard. Right now it's hard. Right now it's hard, but we need to regroup. We need to remember that we are in this storm together, and that we still have a ways to go together.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For the last question, we'll go to Tanya Fletcher, CBC News.
Dr. Henry, looking at the data on workplace clusters,
那么又是说到工作场所的这个零星爆发的案例。
the overwhelming driver, but if that's just looking at staff,
他们主要还是餐厅。他说餐厅是这个主要的。
reflected among patrons too. As in, can you explain how this data drove your decision to close indoor dining? Was it as much for staff as it was for customers themselves eating at the restaurant?
Yeah, it was a little bit of both, and
那么他说这个是不是因为导致了你要决定关闭这个堂吃的这个决定？但是他说主要那些这个职员也有感染。
Restaurants, bars, pubs in Vancouver, but also in Whistler and in the
说
Vancouver coastal
温哥
area.
华这些
Also
地
large
方
part in Fraser Health. So it
还
was a
有菲沙
combination
地
of
区
things, and
很大的部分地
consultation
区
with the restaurant
主要是
association.
结合起来各种因
People were
素。
following COVID safety
如果
plans,
大家
and
都
were
能够遵守
adhering
我们
to
的
them,
卫生
and
禁
they
令
were
的话
working. But
那么
now we started
就
to
会
see
行
a
之有
lot
效
more
的。但是我们看到很多人呢
interactions where people
会
were
忘记
pushing
了
the limits and not
都会
wanting to do
不断
what people
的
asked
突
them
破
to
底
do.
线。
And we saw that in certain communities, and in those places we saw a lot of transmission
我
both
们已经
between
看到了
staff
这
and
些
patrons
这
and
个吃
between
饭的人
staff
和
and their
顾客和
households. So the
职
social
员相互之
connections
间的
that people
传
have
播传
spilling
染。
over into workplaces, spilling over into people who were in those
那么这些人呢
workplaces
又回到上班的地
in
方
the
又在传
restaurant
播里边再
sector
传。
and pubs and bars. And, you know, it is unfortunate, and I hear from people who work in
他
those
说很遗憾，
industries,
我是看
people
到
were
了这些
doing their
很多人
best,
听到了这些
and in some
这些案
cases
例。
it became very challenging. And yes, staff people were becoming ill, and
很多
people were pushing the
这个
limits,
上
not
班的人
wanting
啊
to
就
limit
是
it
这
to
个
6
生
people to
病
a
了。
table, wanting to get together and
因为很多人
congregate
就
at the
不
end
断
of
这
the
样
night.
突破底
So
线，因为一个
it
桌子原来
with
记得吧，
the
只有6个
introduction
人，
of
很多人
more
就不愿意这么
transmissible
干
viruses that
都
were
要
causing
突破这个
infections,
界限。
suddenly those little bits of leeway that we had
所
were
以
no
我刚
longer
才说了，
able to
我们
protect
的
people, and we saw
我
lots
们
of
的
infections in
卫生
some
官就给人一种这个印
related
象
to some
啊，
of
就
those
是
networks in the indoor setting. So yes,
就是
that
这个
was
印
one
象
of the
了，就
main
是
reasons why we
比
stopped those
较
settings
自由
to
相信你，
move them
所以就
outdoors.
存在这个问
Same
题。
thing with gyms and fitness centers. Things that had been working quite well in many places were being taken advantage of in some places, but we started to see across the board increased transmission from some of the group activities that were happening in those settings.
Tanya, do you have a
就是因
follow-up?
为所有的卫生
Yes, please, and if we
措
could get
施
an answer
都有
from
了
Minister
但你没
as
有
well.
去遵
Thanks.
守。
You've cited the data today showing, why it's so important to do mass community vaccinations like in Whistler and Prince Rupert. Surrey continues to see high transmission. So what plans are underway to tackle Surrey as a hotspot? Has the main deterrent so far been its sheer size? And what's your message to people wondering when they'll be prioritized there?
Yeah, so we have been prioritizing, absolutely making sure that the immunization programs in Surrey are
他说
being
这个记
targeted
者
to
问
those
的就是
populations
你
in
居然
neighborhoods
把
that are
威
most
斯勒
at
还
risk,
有
and Fraser
Prince
Health is continuing to work
这
on
些地
that.
区作为
What
热
we've
点了，
been
为什么
looking
数理
at
这么大的
is
数字
looking at？
为
the
什么
case
没有作
rates
为
by
热点，先
neighborhood
让他这些
and
地
the
方的人
immunization rates
先
by
这个
neighborhood, making sure
优
we're
先次
trying
序，
to
先让他们
optimize
打疫苗
everybody who's
那么
eligible
他说可
to
以的
get
啊，
into
怎
the
么怎么
clinic, and
我们
I'm
也是在
looking to
排优先次
community
序
groups to
数
support
理
us
也
in
是
this. I
我
know
们重
Fraser
点
Health
考
has
虑的
been
志
reaching
愿
out
的
to many,
因为我们要
help
把
us
疫苗部署到
get
各个诊所
people
或者是
over
药房
55 and 60
那么亚斯利
in to
康
get
呢
their
这个也是
immunizations.
55岁到60岁
We've
让他们
been
到药房去
connecting
打
with different groups in different parts of Surrey to make sure that we have the right language
还有呢
information
就
for
是
people,
还要
that we have
考
leaders
虑
in
到
those
语言的问
communities to
题，
support
我们也
people to
是
get out
给
and
社
be
区的一些
immunized.
领袖
And yes,
跟
that's
他们
why
沟
we
通，请他
started
们
first with a number
给我
of
们
the
更多的
worker
宣传
programs, and
我们的如何
we've
的疫
had
苗政
again
策、疫苗
outbreaks
策略。
and other clusters that we've targeted with outbreak management that includes immunization. So there is and will continue to be a focus, but
那么我们也会
the other
继
part
续
is
的
also
继续的
true.
关注
You
这
know,
个
we
热
cannot
数理
do
的这
a
些
city
热
the
点地区。
population of Surrey all at once. We just don't have the vaccine, and we need to be able to address people at risk all over the
因
province.
为我
But
们
it
现在疫
is
苗不是每个人
the
所以
most
打，所以我们也
challenging
是引
area
起
right now
热
for
点地
sure.
区的人、
And
全省的
this is
人
where
注意关注
people who are leaders in your
特别
community
是
can
你是社区
support
的
each
领
other
袖
to get
希
out to
望
the
你们
immunization clinics.
给各个人都有支持。那么这个呢，接下来是让卫生厅长用法语说了，这个都不是大问题。那么我再给大家
Disagree with
重
Dr.
复一
Henry
下
that Surrey is a
这
major
个
priority. It's where we was first done and
也是说到了优先次序啊 ，priority 就是优先次序是谁啊？因为 Prince Rupert 以及 Whistler 都是作为热点军去打了，苏里反而没有打啊，这个也是说这个问题。那么伯尼说疫苗不够啊，怎么？那么他也是说到了苏里是一直是我们的重点之重啊。我们不简单要看数理，还要看全省。那么现在说法语了。那么过去的24小时呢？各位观众，我再重复一下数字啊。过去的24小时里边新增的是1205例，那么本省累计呢已经到了116075例了，其中。延安卫生局新增了是301例，飞沙卫生局新增了730例，岛上卫生局新增了38例，内陆卫生局新增了69例，北部卫生局新增了66例，国际获得的1例，那么这样加起来是1205例。目前为止呢，记录在案的就是活跃的案子呢是10052例，其中409例在住院，住院的里边有125个是重症监护，才125个吗？我是125个对。然后呢，很遗憾呢，过去的24小时里边呢，新增了3例死亡。那么这样的话呢，到目前为止，本省新冠相关的死亡到了1524例了。到昨天为止，本省已经有1285600多个人接受了这个疫苗。那么整个省呢，能够接打疫苗 eligible people 是420万人。那现在呢，已经超过了1/4，也就是说，能够打疫苗的4个人里边有1个人已经接种了。好了，各位观众。今天的这个新冠疫情的模型分析以及这个新闻简报呢，就给大家转播到这儿也是感谢大家的收看，祝大家这个。